In Australia, the alcohol industry often still has a seat at the table where alcohol policy is developed, unlike the tobacco industry. Given the conflicts of interest and the growing evidence about industry strategies to mislead the public about alcohol's health risks, the role of the industry in alcohol policy development needs an urgent rethink.
We also know in Australia that more than 17,000 women will be diagnosed in the next year with breast cancer. So we're talking a large number of women. Obviously, there's a range of causes of breast cancer, but we do know that alcohol consumption is one of the known risk factors and a modifiable risk factor. We also know that a lot of women aren't aware that that association exists, and it's actually really important that that information gets out there. And so having industry websites that are providing information that omit that information is actually really going to reduce our capacity to inform women about that link.
I think it's fair to say that the alcohol industry is not the best source of advice when it comes to the link between alcohol and cancer. We know that about 3,200 cases of cancer in Australia each year is caused by alcohol consumption. So should we be surprised that the alcohol industry is misleading or misdirecting the public when it comes to this topic? Probably not. Ultimately, every person who drinks has the right to know that the more they drink, the more they increase their risk of cancer. This is useful research that points to the fact that the alcohol industry is looking to muddy the waters on that question.
My view on the report from the Pettigrew paper is that the alcohol industry, in reflection, has a history of contesting research that identifies alcohol harms. Indeed, I learned that while researching in the past the links between exposure to alcohol marketing and adolescent drinking, when the research that I was involved in was contested by the industry as well. So it's not surprising that the Pettigrew study finds that the alcohol industry does disseminate misrepresentative information about alcohol and cancer, because really contesting the research evidence is often part of the stakeholder marketing of the alcohol industry. And that has parallels indeed with the tobacco industry, who for many years contested the links between smoking and cancer. So there's clear patterns of behaviour by these industries.